Hello, those of you who are joining us, we're going to wait just a few minutes to give everyone a chance to log on, and then we will start our conversation. Well, good evening, everyone, and welcome to the Promoting Health Equity Teletown Hall, brought to you by the Virginia Department of Health. My name is Barbara Hamm Lee, and it is my pleasure to serve as your moderator for this evening's discussion. Hopefully, many of you joined us today on my radio show, Another View, which is heard every Thursday at noon on 89.5 WHRB FM. And we talked about the recent healthcare assessment of residents in Hampton, Newport News, Williamsburg, Poquoson, York County, and James City County. Now, out of the study came 3 areas of concern when it comes to healthcare inequity. Those areas are alcohol and substance abuse, mental health care, information about COVID-19, and now monkeypox. So we have an outstanding panel of subject matter experts to explain the inequities and offer some solutions. And we want to hear from you. So if you have a question or a suggestion, please go down to the bottom of your screen, click on the Q&A section and put your question there. And we will get to as many questions during the hour as we can. So let's meet our panelists. Reverend Jan Brown is the founder and executive director of Spirit Works Foundation Center for the Soul, an ordained deacon in the Episcopal Church, archdeacon of the Diocese of Southeastern Virginia. She serves at Bruton Parish Church in Williamsburg. Jan is a graduate of the College of William and Mary and holds a master's degree in addiction studies from the International Program on Addiction Studies at King's College in London, the University of Adelaide, and Virginia Commonwealth University. She is certified as a peer recovery support specialist, a recovery coach professional, and international scholar on addiction studies. Dan was recently inducted into the Hall of Fame class of 2022 of the Museum of African American Addictions, Treatment, and Recovery. Welcome, Reverend Jan Brown. How are you?
I'm well. Thank you. Thank you very much. And thank you for having me.
Oh, absolutely. Thank you for being with us. Cindy Williams serves as Vice President and Chief Pharmacy Officer for Riverside Health Systems in Newport News. In this role, Cindy is responsible for oversight of pharmacy practice and medication management for the acute care and post-acute care facilities, as well as a 700-member medical group. Now, she received her BS in pharmacy from Virginia Commonwealth University and has completed the executive management program for pharmacy leaders at the Wharton School and the Pharmacy Leadership Institute at Boston University. She received the 2021 Governor and Peninsula EMS Award for outstanding contribution to EMS emergency preparedness and response for her role in the COVID-19 vaccination education. How are you, Cindy?
I'm doing great. Thanks for having me this evening.
Thank you so much for joining me. Anton Green, is the Hampton Newport News Community Services Board Substance Abuse Prevention Program Coordinator. He is a certified prevention specialist and works to support the behavioral health and wellness of youth, adults, and families in the cities of Hampton and Newport News by raising awareness on topics like mental health and wellness promotion, trauma and toxic stress adverse outcomes, underage drinking, tobacco and electronic cigarettes, opioids, over-the-counter medication misuse, marijuana, gambling, suicide prevention, and resiliency. Anton received his bachelor's degree in Human Services Administration from the University of Phoenix. Anton says his mission in life is not merely to survive, but to thrive and to show how hope heals individuals and the community. How are you, Anton?
Doing well. Thank you for having me.
Thank you so much for joining us. And Dr. Ryan McQueen is Chief Behavioral Health and Medical Director of Adolescent Services at Riverside Behavioral Health Center. He is a psychiatry specialist in Hampton. He received his medical degree from Virginia Commonwealth University School of Medicine and has over 14 years of experience in the medical field. He has been affiliated with multiple hospitals in the Hampton Roads area, including Riverside Behavioral Health Center and Bon Secours Maryview Medical Center. How you doing, Dr. McQueen?
I'm doing well. How are you?
Good, I'm fine. And
Good.
finally, Terry Clark. He is the Health Equity Project Manager with the Virginia Department of Health. So thank you all panelists so much for joining me this evening as we talk about some disparities that are occurring based on the community's input on the peninsula, in the Hampton Roads area, and what we can do to solve them. So Terry, I want to start with you because I would like you to just give us a really, 50-foot level overview of what the community assessment found.
Okay, so the community health assessment in the broadest sense is a tool utilized by the local health departments to kind of assess the needs of the community. And with this community health assessment that we're using, that was used specifically, the 2022 one, it gave a really good gauge on overall health because it also recognized the impact that the COVID-19 pandemic had, as well as other services that were provided on the overall, basically, it focused on how all of these different factors affected people's overall health and well-being within the designated population.
Okay, thank you very much. So there were three major areas that rose to the top in terms of concerns from professionals as well as the community. And those concerns are alcohol and substance abuse, COVID-19, and mental health disparities. So I want to go around kind of the squares, and if each of you would tell me at least one major disparity that you see in the care or lack thereof of people suffering from your area. So Cindy, let's start with you because COVID-19 is something that has affected all of us.
Yeah, and I think specifically it has disproportionately impacted communities of color. And when I say that, not so much in the number of individuals that have gotten COVID, but we know when we look not only at the national level, but at the state level and also in Hampton Roads, that for individuals that have gotten COVID, if you are either Hispanic or African American, you are much more likely to be hospitalized and die from COVID. And there's a number of factors going back years around health inequality that are really driving that. So, one of the things early on when I was charged with overseeing the vaccine program for Riverside, I recognized that when we had limited vaccines back, think about early when there were lines and people were really wanting to get vaccines, it was targeted more at the older populations. We made a decision that we needed to take vaccines into vulnerable communities. And so we formed partnerships with individuals and groups that already had trusted relationships in those communities. And it was primarily the faith-based communities in Southeast Newport News. And so I think that's how we started to address some of the disparities we were seeing and making sure that there was equitable distribution of vaccines across our communities, and especially in those communities that may have had greater challenges in getting access.
Okay, Jan, what about in the substance abuse area or substance use area? I learned today.
Yes, and thank you. Primarily, what we have seen is, increased overdoses, both fatal and non-fatal. And so the issues around access, quality of care is another piece. And more and more people, especially that intersection of COVID, the isolation, people were using in their homes and didn't have ways to get out to receive care. So as people are reemerging, the problems were already there. COVID just highlighted or put a spotlight on them. And so just kind of that reemergence, people who were in recovery, returned to use. So it's been a very difficult 2 years. And so, the intensity of the drug supply has also been a driver and just an inability to keep up with the poisonous drugs on the streets.
Well, Anton, you're kind of in the same area in terms of the work that you do. What are you seeing
Yeah,
in
and I
terms
would
of
say
disparity?
everything that Ms. Brown has said, but the impact also on our youth. So having that access that they were locked in at home too during COVID, but having that access to means that's in their house, or having like with their parents having alcohol delivered to home. So having that access directly there on a regular basis, increasing those chances of them getting started on a certain substance or opioids or alcohol, on top of the components that mental health tied into, because you're just isolated, and so now your brain is ticking a different way, and things that occupy and things that you can get involved in and connected to, that's positive or negative.
Hmm. And Dr. McQueen, same area for you with mental health, particularly with adolescents.
Right. The main thing that I noticed is, like everybody said, access, and then again, lack of resources. Like I mentioned earlier, there are about 8,300 child psychiatrists in the country. There's about 28,000 psychiatrists total. So one thing that works for us at Riverside, because every every psychiatrist can't always see everybody when they need to be seen, is to create a team, just like we're doing now. Create a team where you have therapists, social workers, and nurses. You have admission specialists. You have people that can actually reach out for you and figure out some of the things that I need to figure out to best help the patient that's in front of me, best help those kids, those adolescents that I'm seeing every day.
So why is it important that the medical profession as a whole kind of change its perspective? Once upon a time, it was, I am the doctor, you come to me, you get your services, you listen to what I say, and we quickly realized that that wasn't working. And particularly for a lot of minority communities, because of that lack of trust. How much, Jan, I'll start with you. How much of lack of trust of the medical profession plays into the disparate treatment options that people may or may not
It
have?
sure, it plays a significant role, as kind of we mentioned earlier. And one of the pieces that's been really important is the credibility around who is working with an individual. One of the pieces that's really nice to have as peer recovery specialists or recovery coaches, navigators, are these are people who have lived experience. And so our ability to engage the person who's in front of us, it decreases tremendously. And, for us to be able to say, I've been where you are and I know the way out, let me walk alongside you, has been really helpful. Equally, finding trusted people in the community. You mentioned the faith community earlier. We are still, among the most trusted vocations that exist. And so that's another thing. And one of the pieces that's often quite interesting is being able to provide, as the people we work with talk about, street cred. And so I may not have had a particular experience, but I can point to somebody right next to me who has, and immediately that person can vouch for me. So we have a long way to go. We've come a long way, and it's really important to rebuild that trust, because it's all about the relationship.
Cindy, I would imagine that every time you wanted to talk with groups about getting vaccinated and so forth, particularly in the African American community, you heard Tuskegee.
Yeah, and I think, and maybe rightly so, right? I think unfortunately when the vaccine started being rolled out, again, regardless of what political party you're with, it was really politicized, and that was very unfortunate, right? Because I think it took attention away from the good work that the scientists and the researchers did. But I think there was a lot of apprehension about, this is brand new technology. We've never used this technology for vaccines before. What is it going to mean? And I think a lot of unanswered questions, especially in specific populations. So what is it going to mean if I'm pregnant, right? What if it means if I'm of childbearing age? And so I think being able to engage and really understand what is the specific concerns. I remember I was helping to staff a FEMA clinic in Hampton at one of the churches. Actually, we did a lot of outreach and continue to do a lot of clinics in faith-based locations because of the trust issue. But there was a young woman, African-American woman, that came in towards the end of a clinic one day. She registered, she got all the way back to the chair, and she said, "I'm not going to get the vaccine." So I was in the back preparing vaccine, and the nurse came and got me and said, "Can you talk with her?" And I said, "Happy to have a conversation." And so I think really trying to understand what is that root cause behind the fear. In her case, it was because she was of childbearing age and she was concerned, is this going to keep me from being able to have a baby? And that particular day, I wasn't able to change her mind. But what I did say is take the information, here's some reputable sources. Let this be the beginning of the conversation, not the end of the conversation, because people have their beliefs and you need to acknowledge those beliefs and helpfully support them to gain the information they need to make a good decision for them.
Anton, I'm wondering if the whole idea of community services boards and the services that you all offer, is there a stigma around going to you or to your organization and to get help?
Definitely. Not knowing exactly what the community services board does. We're not the organization that gives you those hours for picking up trash or whatever. So knowing even what the CSB stands for, what does CSB offer, not knowing that access can come with therapy and counseling, or even if you're uninsured, helping you get insurance, or you may not have to be face to face with a person. You could do a telehealth over the computer, over the phone. So just knowing about the services that we offer, knowing that there's multiple levels of counseling or therapy or group therapy or treatment, and there's different ways that you can access through the CSB, and ways that once you're in, you'll have different layers that can assist you through that process.
And do people feel that they are getting the same quality, and I put that in quotes, going to CSB as opposed to going to a private doctor? Or because I know that there's also a lot of stigma around whether you're getting public health, if you will, versus private access.
Yeah, definitely. That would be on that individual concept, but knowing that the CSB is a broad range of services, so you may be accessing for one component, but then you'll get case management involved in with that, or medication management, or tap into another level of something that you're struggling with. So just knowing that there's multiple levels within our agency that you can be connected to.
Okay, let me remind our audience that we are taking questions from you. So please go to the chat button at the bottom of your screen, the Q&A rather, and pop in your question. We want to be able to answer as many of your questions as possible during this hour. Dr. McQueen, I know that you really have to deal a lot with the whole stigma around mental health and the whole idea of whether or not, particularly in minority communities, if it's okay to go talk to someone.
Yeah, one of the biggest things I think in the minority community and just stigma in general is just talking about it. Keep communicating, keep talking about mental health with your children, talk about mental health with your parents, talk about mental health with each other. You don't, of course, always have to let everybody know exactly what's going on with you, but if there's a particular issue or something that you feel like you need help with, talk to people about it. And then, of course, if you're talking to someone and let's say we don't know what to say, I don't know what to say in return to you, just listen. And sometimes silence is absolutely amazing. Silence can get you through a lot of different things when you're trying to listen to somebody and understand what's going on, and then reflect that information back to that person. And then if there's something concerning that's there, then hey, let's reach out for help. Let's go to the CSB. Let's go to Riverside. Let's go to the emergency room. Let's see what we can do to get you the help that you need.
In certain generations, some people may be less willing to seek mental health help. When you're dealing with children or young adults, adolescents, and they want it and perhaps their parents don't, how do you manage that to help them get what they need?
So a lot of times what I do is that, especially on the inpatient side, when the kid is already in the hospital, there are many times where the kid will tell me what they want and the parents don't necessarily want it. But luckily with adolescents, I would say probably 75 to 80% of the time, if the child wants to do something, then the parents will say, hey, you know something? My kid's growing up. They need to learn to make these decisions on their own. Let them go ahead and maybe start this medicine. Let them go ahead and do this. Let them go ahead and do that. And a lot of the parents are open to what the child wants simply because of the fact they want the child to get better. Same thing with the young adults. A lot of those parents want the child to get better, so they're more open to it. Every once in a while, we'll run into folks who aren't as open, but in those situations, you listen and you try to understand what is going on with that particular family. But at the same time, even if let's say the child doesn't want medication, or let's say the parents don't want medication, then what you can do in that situation, the child is still getting therapy in the hospital. The child will then learn how to reflect some of that information back to the parents or the guardians, which can in turn change their mind down the road.
Okay. Dan, we talked earlier about language and how language can be a barrier in terms of people seeking treatment, getting the help that they need, and so forth. Can you expand on that a little bit?
Sure. One of the things that we say is that words matter, and so when you're listening, one of the things that I had thought about, is around the language of people are either clean or dirty, instead of things like somebody tested positive or somebody tested negative, and so that's an area where we hear a lot of, and we hear it not only from people in the community who may or may not be educated. We also hear it within the field, and some of it's jargon, some of it's kind of left over from years ago. Earlier I mentioned, that the proper terms are substance use disorder or alcohol use disorder, and yet we still hear substance abuse and those kinds of things. And we also talked about the with neonatal abstinence withdrawal syndrome, or there are no such things as addicted babies. They are babies who are born substance exposed. And so, having those kinds of hurdles for people to get through. I mean, a lot of our women that we work with, pregnant and parenting women, are afraid, because of the criminalization of their issue. And so really bringing this into the arena of health, versus a crime, and that there are medical treatments that are available. There are, we've got examples of therapists who are here, and psychiatrists and others. And so I think it's one of the issues that, along with trust, of course, but I think it's one of the issues that presents extreme fear and unwillingness for people to move forward because they're not confident that the right system of care is going to pick them up.
How much does socioeconomic challenges play? How much of a role does the socioeconomic challenge play in terms of people being able to access the type of care that they need to stay healthy? I mean, they may not necessarily be sick, but even just to stay healthy, to get that annual checkup, so forth and so on. Cindy, let me start with you.
Yeah, so I mean, I think there's multiple components, right? I mean, I think it's a wonderful thing that we did expand Medicaid in Virginia. I think that has opened up healthcare to a lot of individuals that perhaps didn't seek routine care before. So I think that's been a big win between that and having Obamacare, where we had just greater access for healthcare. But it's not always just about insurance, right? I think that you've got transportation, you've got issues with, you've got a job. Do you have a job where you can actually take time off, whether paid or not, to get to a physician's appointment? Because we all know most physicians, I mean, even though I think we've seen some movement and having longer hours and Saturday hours, most business happens Monday through Friday, 8 to 5. So I think in addition to just the insurance from a socioeconomic, I think you have to think about the other determinants of health. So whether that be transportation, whether that be access because of jobs, access because of childcare. So I think there are many layers that really go into whether individuals can afford to get health care. And then I think there's the value system and trying to understand whether it's trust or whether it's just healthcare providers understanding maybe the cultural differences somebody's coming from. I mean, we deal with that a lot in medications, generally with medication adherence. And you really have to understand if somebody isn't taking a medication or not willing to take a medication, what are really the root causes behind that? And it may be something that's really more cultural with that individual than it is with the medication itself.
There are times where we spend a lot of time talking about the medical community and what it needs to do. But what would you say patients or people need to do in order to make it more of a partnership? Anton, let's start with you.
I would say increase your awareness. So doing your own research to know what like your insurance covers. So knowing that some of those preventative cares are included in your insurance, or knowing that some of those warning signs that are out there associated with certain disorders that you may recognize in yourself or in your child, that you can talk to somebody about. So just increasing your knowledge, increasing your awareness of what you have access to, where to obtain that access, and some awareness about some of those early warning signs that you may be able to help curb before it becomes to a crisis situation.
Same question to you, Dr. McQueen.
I would say one of the biggest things goes back to communication. There are a lot of patients that I see, and they don't necessarily want to say anything that they think is going to offend me because I'm the doctor. So my thing is go ahead, tell me what you're thinking. I'm not the one who is taking the medication. I'm not the one who's experiencing the symptoms. Tell me what you're thinking. That way we can try to meet in the middle. And it may not be at the first appointment, or it may not be during that first session where we meet in the middle. It may take more than one session, but I'm willing to try to find a middle path that kind of helps. I would like for people to kind of communicate more with me and tell me, more of what they're thinking and how they're feeling.
Okay. Jan, what about from your perspective?
I would have to say, I mean, some of it is around personal responsibility and accountability, and, just having the willingness to show up for oneself, and the belief that they, a lot with addiction and substance use disorder is that the loss of hope, especially as you're looking around at the numbers that are increasing around overdose deaths. People have said, I'm not going to any more funerals. And so to just be able to have hope that things can be different, and to not only pay attention to what's negative out there, because there is a tremendous reason for hope. And so I think that piece of personal responsibility and showing up for oneself.
Cindy?
Yeah, I mean, I think sort of building on a few things that were discussed. I mean, I think having that open communication, and I think that does start with developing a trusting relationship with, your care provider. And, sometimes that care provider may not be a physician. Perhaps it is a pharmacist in your community. Perhaps it is some other type of accessible healthcare provider in the community. I mean, I know individuals where the school nurse may become a resource, right? Because that's a trusted individual in the school. So I think building that trusting relationship, but I think then also being willing to open up and be honest about what's going on. I mean, I can remember cases where, perhaps because of the stigma involved, perhaps because folks felt they were letting people down, maybe a patient hasn't been as forthcoming about what's going on with them, which then can become a real barrier to their care. Because if you don't have a full picture, it's really difficult to move forward with really finding what is the best solution, patient-centered solution that the patient buys into, but what's the best solution to move forward?
Terry, now that COVID came about, I mean, people knew about the departments of health across the country. We knew that there were departments of health, but you guys took on a whole different perspective once COVID hit. How are people perceiving the Virginia Department of Health at this point?
So I would say it's kind of mixed. It's some people like the work that we're doing. We have people that are excited to get vaccinated. When a new vaccine comes out, some people are jumping in line to go get vaxxed, but there are some where, and a lot of times it really depends on the region that you're in. In some regions, they're not really taken to the vaccines too well, or I mean, just in public when you think about the health department. If there isn't a relationship with the community, I'm not going to go there for anything. It's just going to be another building that I pass by on my way to the grocery store or handle whatever business that I have to take care of.
And you bring up a really good point, because sometimes people don't know what the services are that you all offer. So I'm going to do a round robin, and Dr. McQueen, I'm going to start with you. What does where you are, the Regional Medical Center with Riverside, what do you do? What kind of services can people get if they came to see you?
Right, so at Riverside Behavioral Health Center, we're a department of Riverside Regional Medical Center, of course. There, if you come like through the front door and you need to get assessed for admission, the first people who are going to talk to you are our admission specialists. Nurses, therapists, therapists in training, social workers. They're going to assess you and see if you need to be admitted or not. Once they get that information, then they'll call either myself or Dr. Karpoff or one of the nurse practitioners to get admission orders, or to, of course, just to be sure if you need to be admitted or not, and then we'll give orders for the person to be admitted. If you don't need to be admitted, then we can give you resources for the community to follow up with either the CSB or substance abuse wise. We have an intensive outpatient program. We have a partial hospitalization program where we can refer you to that as well. So if somebody doesn't need to come into the hospital to detox or detoxification off of alcohol or a substance, then we can refer you to our PHP or our IOP so you can get treatment on an outpatient basis.
PHP or IOP, what's that mean?
So PHP is partial hospitalization program and IOP is an
Okay.
intensive outpatient program. So let's say somebody did come out of the hospital for detoxification. Maybe the next step down is a partial hospitalization program. Groups are occurring Monday through Friday, except on Wednesday, usually from about 9 to 3. We have therapists, a provider sees them. So sometimes I'm there to see them. There's a nurse practitioner who sees them. There's another psychiatrist who helps. And then the intensive outpatient program is Monday, Tuesday, Thursday, Friday from 9 to 12. And it's a lot of substance use treatment.
Okay. Anton, what does the Community Services Board do? When do I know that I need to come to you?
Well, CSB, like I said, is a gamut of services. We are behavioral health, mental health, and substance abuse treatment, prevention, treatment, and recovery. So across the lifespan for child services and adult services, getting that preventive information. So that's my department. Just getting that community awareness, increasing health promotion in your wellness journey. And then you have the treatment component for, like I said, child and adult. So therapy, counseling, medication management, medication assistant treatment programs, just like I said, a gamut of services. And then you have recovery. So in building up those certified peer recovery specialists that has gone through that crisis, gone through those situations, now that's on the other side, and helping the community to build that trust and build those connections and build up that information. So just letting it know that it's possible to come over with this, to recover and be on the other side and now give back to your community.
Okay. Dan, what does Spirit Works do? And I'm curious, I want you to answer two questions, because one, what is Spirit Works? And then secondly, so we have 3 professionals that are intimately involved with substance use. And I'm wondering, is that because everybody on the peninsula is on drugs or what? I'm being a little facetious, but you see my point being, there seems to be a lot of opportunity to get help. Are there as many patients out there that still aren't getting it?
Sure. So I'll start with that piece of the question. One of the things, sadly, that we know is that we will always be in business. And as Dr. McQueen said earlier, there isn't enough care and part of it's because of the need for the right level and the right type of care, and looking for, evidence-based practices and things like that. So folks have to be really careful, where they're getting their information from and who you're going to see as your care provider. And so what we do at SpiritWorks, we're what's called a recovery community organization. And our job or role is to help people remove the barriers that exist for them to be able to access the care and then the ongoing support that they need to maintain or sustain recovery. So we would come in sometimes, before somebody would go to the CSB, they would come to SpiritWorks and kind of tell us what's going on in their lives. And we would then be able to make usually a warm handoff, because we work very closely with CSB. And so, if somebody presents that, gosh, I don't have a way, for my child to have care while I go to the appointment. So being able to provide them with some information as to the community resources that exist. Somebody mentioned earlier, gosh, I have to take the bus or something along those lines. So making sure that folks have, the practical support of a bus pass, or, so it's not that people don't want to participate in services. As somebody mentioned earlier, usually there's a reason that they're not able to. And so we're able to, to really ascertain what some of those reasons are, because we've been there. There is no judgment from us, and then once somebody finishes their formal treatment, if you will, we're there to kind of continue to walk alongside them. We have a physical center. And so, we like to describe ourselves as the YMCA for all things recovery, right? So people can just come in and hang out, or they can come in and use the computer. They can come in and there will be people who are there. So that companionship or social support we're able to provide.
So those wraparound services that support the person as they're going through.
Absolutely. And then we do a lot of education, because as you've heard from me before, words matter, and misinformation is something that needs to be overcome.
And Cindy, we all know what a pharmacy is, because
maybe I'll talk about some of the community outreach that Riverside has done, and it will continue to do, because we obviously have a lot of different services. But one of the things that we think is very important is making sure that healthcare is accessible in every community where we have a footprint, basically. So I'll talk about a couple of things we're doing in the Newport News area. One is, we've had a long-standing clinic on Jefferson Avenue called the Brentwood Clinic that offers family medicine, obstetrics, pediatrics. It actually has a pediatric immunization clinic, not just COVID. It has a COVID clinic now too for vaccines. But, we've tried some innovative things there, including really trying to get at some of the social determinants of health. So we started several years ago with a program that we call Food as Medicine, because we know that for certain disease states, you're never going to get to that optimal health if you live in a food desert and you're not able to access healthy food. So we've partnered with the food bank, and we offer healthy food boxes to this cohort of individuals. So that's one of the things there that we've done that's sort of unique. One of the other things that we're just starting up there, because we know that there's been a real decrease in the number of pharmacies in some of our communities. And so we're now starting to see pharmacy deserts. There's, everybody's being challenged with a shortage of help. And so hours are being reduced. There's no 24-hour pharmacies on the peninsula anymore, which is, a shame. Now we now know that, there are pharmacies. So at the Brentwood Clinic, the pharmacy that was in that shopping center has closed. So we're looking at creative ways to not only be able to provide some prescription services there, but also to team that up with a group of specialists we have at Riverside that work with individuals to find affordable medication options. So if you are either underinsured or your insurance has high copayments, what can we do to either get a lower cost product, to get a manufacturer's assistance program? But our goal is to make sure that every patient gets the medications they need, regardless of their ability to pay. So I think one of our big focus areas is really trying to get out in the community. We've likewise just started a similar kind of opportunity on the Southeast Newport News, and we'll implement many of the same programs.
Okay, we've got some questions from our audience, so let me go to then. First question is, what are the best suggestions for a health district trying to undertake vaccine hesitancy in their localities? How can they approach this in a way that doesn't repeat past efforts, avoid things that suggest public health is just pushing a certain agenda? Cindy, let me come to you first, and then I'll come to you, Terry, after that.
Yeah, so, I think, and what I've learned over the, I've probably staffed, it's probably getting close to 100 vaccine clinics in the last year and a half. And I think you really do need to think about meeting individuals where they are and understand that not everybody may be ready to get that vaccine today, but make sure that you're providing the most accurate, up-to-date information. Sometimes it may be that interaction, like I talked about earlier, where the individual just isn't ready, but can you further their education to help them make a good decision? Because what I always, when I've had individuals that have come to clinics and, just decided not to get the vaccine, I always make a point of saying at the end of the day, it's your decision, it's your health. Let me tell you why I think it's important, but you need to make the decision at the end of the day. So I think we do need to understand that it's really important. And I'm not talking about just COVID vaccines. We know that childhood immunizations have fallen far behind. And, we're seeing these cases in New York, which quite honestly are scary, with polio. And so I think it is that education, but I think you do have to meet people where they are and understand they may not be ready today, but let's try to give them factual information.
Terry, you want to add to that question about public health and how do you undertake vaccine hesitancy in localities and approach it in a way that doesn't repeat the past efforts that the health department is pushing a certain agenda?
So I think a big part of when you're trying to target vaccine hesitancy, I think coming from a local health district perspective, it's all about community building. Knowing the community that you're working with, making those connections within the community. One of the things that I've had conversations with health departments in other states, one of the things that they're undertaking, which I thought was pretty interesting, was the use of CHWs, so community health workers. They're people that you're able to utilize that have a better pulse on the community. They're people within the community that know a lot more about the community than a person that may consider someone in the Virginia Department of Health a suit. So to speak. So somebody that they know is out there going through kind of the same thing. Someone that looks like you and me is able to better give me information in a way that I may understand it. They're able to kind of take certain considerations. Is it a Spanish speaking population? Does this person that's approaching me speak Spanish, or are they coming out to me with the translator app, which most likely is not going to go over too well? But you want to know that the person approaching you is going to have your best interests at heart. So I guess when it comes to just targeting those different vaccines, again, location is very important. But if you look like me, I'm more so going to feel like you know exactly what I'm going through, and I can relate to you a lot more. And I think that's very important going forward, because it really only takes one person at kind of this point where we are with vaccines to kind of help somebody change their mind.
Yeah, and Barbara, if I can build on just a little bit about what Terry just said, I think that he's spot on. I mean, one of the things early on that we recognized is, those partnerships with trusted members of the community. So, I think back over the last year, and when we were trying to address vaccine hesitancy, partnering with the NAACP, for example, in one of our rural communities, we've done that in several locations. Partnership with the Urban League. We did a panel where we had a number of the members of the Urban League that had been seriously ill with COVID, and talking about how they felt it was so important to get vaccinated. So I think really engaging and knowing the community, but really also finding those trusted partners in the community that can really make a difference when they're telling their stories.
Okay, we have another question from the audience. For Riverside Behavioral Health, so that would be you, Dr. McQueen. If an individual is seeking medication for the treatment of an opioid or alcohol use disorder, will you support that transition? Do your programs induce induct an individual prior to leaving? Can an individual seek medical health services continue on MOUD, which I'm not sure what that is, such as methadone, if there is a desire? So I guess it's a treatment, a type of treatment.
So at Riverside, we don't always induct some of those medications. So if somebody's coming in on with an opiate use disorder and they want to start Suboxone or methadone, those medications we don't start at Riverside. If you're on the inpatient side, we could use Suboxone maybe briefly to kind of help somebody through the withdrawal period, but you need a special DEA license to prescribe that. And we don't prescribe those on the outpatient side in PHP or IOP. Now, if there are medications, let's say somebody is coming through, they have alcohol use disorder and they needed to start something in IOP or PHP, like naloxone or naltrexone, one of those types of medications to get them through a particular disorder, to help them through treatment, those medications we can start. So it is, I guess it's more so to say it's on a case-by-case basis, and we can determine what the person needs there, and we can either start some medications, some we can't, but we can figure it out during those appointments.
Okay. Cindy, go ahead.
I was going to say, but within Community Services Board, we do offer medication assisted treatment programs for Suboxone and lost my train of thought. But yeah, for both medications.
For both medications.
Right.
Okay.
Yeah, our CSB has grant funding that covers that.
Mm-hmm.
So it really depends on what your need is, I'm assuming, and that also determines where you should go. Is that a fair statement?
Right, I think that's fair. And if I can't prescribe Suboxone, then we can refer somebody to the CSB.
Okay.
Mm-hmm.
Cindy, let's talk about monkeypox. I read an article today in the Richmond Times-Dispatch that talked about the health department in Richmond asking some pretty personal questions in order to determine the level of risk of getting monkeypox, because they're saying because they have so few vaccinations. But could that be a barrier in terms of people seeking help, and what should people be looking for in terms of monkeypox?
Yeah, so, I think that we do need to be very careful with stigma with monkeypox. I mean, I think we've recognized early on, we don't want this to be like we experienced back in the 80s with HIV when it first became, an issue. It's finding that balance, I think, around who is going to benefit most from the vaccines, because we do know, unfortunately, I mean, it sort of takes me back to COVID, that, there are limited vaccines right now as we're trying to ramp up the manufacturing. But I think it's finding that balance between how do you assess that individual to make sure they meet the criteria, because there are criteria that have been laid out by the CDC, but perhaps doing it in a way that allows the individual to attest that they meet one of the categories, perhaps, versus having to give their entire sexual history. I think it is trying to find that right balance that says, we acknowledge that, we need to make sure you qualify, but maybe not have to have all the details and just have the individual attest that they meet one of the criteria that's been laid out. I just think we are going to need to be careful. I think the other thing we need to be careful about is that even though we know that the disease is primarily or most easily transmitted by close personal skin-to-skin contact, we also know there's other ways that this can be transmitted within families, for example, with close, even face-to-face contact, doesn't have to be sexual in nature, with sharing of bed linen. So you start thinking about communal living. I really worry a lot in the homeless population about, what that could mean if you're sharing, towels or whatever it happens to be. So, I don't want individuals to think that you have to have a certain lifestyle in order to get monkeypox, because I think we're going to find it's going to be broader than that. It's not going to be like COVID. But, certainly I think we need to get good factual information out in the community so people understand the risk and understand what they can do to mitigate that risk.
Okay, we've got some more questions from the audience. Is there any truth to the smallpox vaccine is effective against monkeypox?
Yeah, so it's interesting. I was reading an article just earlier today that was in one of the journals I get around, how effective is the smallpox vaccine, that we're going to be against monkeypox. And, based on the way those pox, the orthopox viruses are, there's a strong belief that you'll be able to have that cross effectiveness. But honestly, we're very early into this. And so certainly the CDC as well as the WHO are closely monitoring. What we do believe we know is that the sooner, because right now the vaccine is being offered to those that have been exposed or feel like they've been at a high risk of exposure. What we do know is the sooner that you get the vaccine, ideally within the first 5 days of exposure, the better it's going to be at preventing you from getting a serious case. Is it going to prevent it completely? Perhaps not, but what we understand is that it will be a lesser case and there'll be less discomfort for the individual.
So outside of the lesions, are there any symptoms that people need to be aware of? That
Fever
could
tends to
indicate that
be,
they've been
fever, headache tend to be some of the ones that come most to mind. Certainly, the actual rash itself, the lesions are, I think, the very telling sign. But prior to that, you can get a prodrome that tends to be headache, fever, and that type of thing. Certainly that could be from other things as well. But if you're in a risk category and you start having some of those symptoms, a good idea to get checked out. Because again, the earlier that we can identify someone has monkeypox, not only can the risk of exposure to others decline, but that efficacy of the vaccine also will improve.
So as we start to wrap up, oh, wait, we got another question from the audience. Hold on a sec. No, that's not a question. Okay. Audience, if you have other questions, we've got about 10 minutes left in the hour. We would love to hear from you. Just go to the Q&A box and ask your question. I asked this question earlier and I'm going to ask it again. If you all had a magic wand and you could make any disparity go away that is really prevalent in your area of expertise, what would that be? How would you change it? Anton, let's start with you.
Magic wand. I would say, well, stigma. So just that connotation that health is individualized, that you need to deal with it yourself. It's a community approach. It may be multiple levels, multiple layers, but wellness is a journey. So just knowing that it takes time to build up certain areas of your life, and then one connects to another. So if your mental is off of whack, then maybe your physical will start changing, your occupational will start decreasing, your finances. So just knowing that everything's connected, but that stigma of getting in the way of getting connected to the community, to yourself, to others, to eliminate that out of the conversation.
So you would take your magic wand and get rid of the stigma.
Yes.
Okay, Cindy, what would you do if you had a magic
I may
wand?
take a little different spin than I did this morning, and maybe I'll just put on my pharmacist hat, right?
Okay.
And this is, it may be broader than just health disparities, but I think, affordable access to medication. So many chronic diseases really require, that medications are administered. I think about diabetes, for example. You need to have insulin. Well, when it's $150 a bottle, that is not affordable for some. So I think having accessible, affordable medications to treat chronic health conditions would go so far in this country. I think recent legislation passed at the federal level. It's hopeful that's going to go a long way in helping us get to that. But I think getting to a place where affordable healthcare, including prescription medications, is accessible for all, I think would make a huge difference in closing some of the gaps from a health disparity standpoint.
Okay, before we continue around our round robin, another question has just come in from the audience. If I have Medicaid or no insurance, can I be seen at Riverside Behavioral Health? Do I need a referral? Dr. McQueen?
You don't need a referral, and yes, you can be seen. So just come on in and we can figure out.
Okay.
We can figure
Well,
it
while
out.
we have you, Dr. McQueen, you got your magic wand. What disparity would you get rid of?
You know me, I want more psychiatrists. So there are not many of us around. I want more psychiatrists. I see medical students come through RBHC every year. I probably see maybe 12 to 14 or so. And I try to get one of them to go into psychiatry at some point because it's just not that many.
What is it
Also,
that's
I think-
stopping people? What's stopping them?
What's stopping them? It's not a specialty that a lot of people want to go into because there's really no procedures or anything that go along with it. So people think that it's not going to be able to pay their bills and that kind of thing, and that's not the case. That's not the case. You're still a physician. You're able to do everything that you need to do. You don't need procedures to be able to do what you need to do, and you can help people in a different way than other specialists can. And the other thing that I would say is that thankfully, we have a lot of NPs and PAs who are going into psychiatry and specializing in psychiatry. We have 6 or 7 great ones at RBHC now, and they're doing an amazing job, and they help me get my job done every day.
Jan, what would you do with your magic wand?
Anton mentioned it earlier. I think the stigma and misinformation and frankly discrimination when it comes to accessing care. And it goes, from the individual who needs the care all the way to the care system and to include some of the, institution and policy and those kinds of things. I think if people really understood substance use disorder and addiction as a chronic health disorder, not a criminal issue, that we would be able to change the quality of life for many people.
And that would be really fair, especially since for a long time, it depended on the community that you lived in that determined whether it was a criminal issue or a health issue.
Correct. I would even suggest that it also depended upon the color of your skin in terms of the community that you lived in also.
Okay. Terry, if you had a magic wand, what would you wave to make public health better?
I would, I guess specifically since I deal with I would probably say that magic wand's pulling politics out of health. It has no place there. When you look at it as, hey, like we are here to help. I could go on for days. We're gonna leave it right there. We got a couple of minutes left. Passionate about that specifically. We gonna stay with that.
So no politics. It is very interesting to me that a lot of decision making in medicine or in health is made, or the decisions are made by people who are not in the profession. And so I'm sure that's got to be a frustration for you all also. Those of you who take the time to be in the arena and really are working with people on a day-to-day basis. Audience, we do have time for one more question. If anyone has a question, please put it in the chat right now. And if not, we do have an opportunity for you to be able to share with the Department of Health any other ideas that you may have on ways that we can overcome disparities in healthcare. And if you do have an idea, please reach out to Terry Clark. Terry, raise your hand again. He is the Health Equity Project Manager with the Virginia Department of Health, and his email is Terry, Terry, .clark@vdh.virginia.gov, and Virginia is spelled out. So that's terry.clark@vdh.virginia.gov. Give them your ideas. They truly are looking for ways to make sure that healthcare is equitable for everyone. So thank you so much this evening for joining us for this insightful question, insightful conversation. And let's all work together to be able to make health equity a reality for all of us. Thanks. Oh, wait, hold on. Before we sign off, we got one more question. Yes, the earlier conversation that we held on Another View is available on podcast. You can go to anotherviewradio.org and find the show there. Okay. Thank you all so much for joining us this evening. Have a safe evening and be well.